As we look forward to ECCO 2025, let's preview what's on the agenda for this exciting event. ECCO 2025 presents key therapeutic advancements. The TNH diet offers a more tolerable alternative to exclusive enteral nutrition for Crohn's disease, with 88% adherence versus 52%, while maintaining similar remission rates. Ustekinumab reduces secondary immune-mediated disease risk, reinforcing its safety over anti-TNFs. Infliximab data in perianal fistulizing Crohn's disease show suboptimal trough levels in 9% of patients versus 46%, highlighting the need for dose optimization. Long-term data confirm lasting benefits of emerging therapies. Risankizumab, Etrasimod, and Upadacitinib sustain clinical and endoscopic remission over 4 years. Combination therapy with vedolizumab and upadacitinib shows a 63.4% early clinical response and 61.5% endoscopic response, surpassing monotherapy. Guselkumab achieves superior ulcerative colitis remission rates of 27.6% versus 6.5%, positioning it as a strong first-line option. Advances in biomarkers and precision medicine are reshaping treatment. HLA-DQA1 alleles predict anti-TNF failure, while fecal TNF levels above 7.07 picograms per milliliter indicate higher colectomy risk. Metabolic profiling suggests tryptophan metabolism outperforms CRP in predicting JAK and IL-23 response. FTIR spectroscopy emerges as a biomarker for fibrostenotic Crohn's disease. Microbiome research strengthens its role in disease progression. IBD patients show altered tryptophan metabolism, increasing inflammation. The oral gut microbiome axis is a key factor, with Porphyromonas gingivalis linked to UC progression. Machine learning-driven microbial biomarkers aid IBD diagnosis, while gut microbiota profiling achieves 88% accuracy in distinguishing Crohn's from intestinal tuberculosis. The global burden of IBD continues to rise. Ulcerative colitis cases are expected to increase by 30% over the next decade. Pediatric IBD patients have nearly double the risk of depression and anxiety, especially those with perianal disease and multiple biologics. Korean IBD patients face a 57% higher malignancy risk. In Brazil, Crohn's disease prevalence is projected to rise by 288%. While biologic therapies reduce hospitalizations by 59% and surgeries by 55%, access remains a challenge. Digital health innovations are improving IBD care. The promotion study finds that a nurse-led intervention increases patient-reported outcomes to 71.8%. Risankizumab maintenance therapy improves urgency, pain, and fatigue while reducing fecal calprotectin levels. The tasty and healthy diet maintains remission in 49% of Crohn's patients, offering a flexible dietary alternative. AI is enhancing IBD diagnostics and treatment prediction. Machine learning improves endoscopic assessment and reduces inter-reader variability. AI-driven frame selection removes 80% of non-informative frames, saving 83 hours of review time and improving scoring accuracy. AI histological models achieve an AUC of 0.95 and 92% accuracy in predicting Nancy grades, reclassifying 22 of 76 inactive UC cases as active disease. AI is advancing IBD imaging and treatment response. ML models analyzing 9,658 radiology reports classify inflammation and stenosis with high accuracy. AI-assisted rectosigmoid endoscopy shows strong agreement with full colonoscopy, with a kappa value of 0.944. AI models predict anti-TNF therapy response using body composition, with muscle mass and protein levels linked to better outcomes. Nutritionally at-risk patients show earlier loss of response, with a p-value of 0.041. AI is also improving disease prediction. Machine learning models using routine blood tests predict Crohn's up to 10 years before diagnosis in adults and children. Google Trends analysis shows rising IBD awareness in Africa, with search interest expanding to 39 countries for Crohn's and 32 for UC. AI-driven analysis of IBD registries achieves 98.1% sensitivity and 97.1% specificity, enabling real-time clinical data retrieval. AI is aiding surgical decision-making. Random forest models predict colectomy risk in UCPSC patients with 88.2% accuracy, identifying UC duration over 11 years as a key factor. AI-driven natural language processing models analyzing complex perianal fistulas in Crohn's disease show hospitalization rates of 64% and surgery rates of 36%, significantly higher than in overall Crohn's patients. Molecular classification is driving precision medicine. Unsupervised machine learning clustering of 2,490 RNA sequencing biopsies identifies 3 molecular subtypes for UC and CD, linked to disease severity and treatment response. Want to stay ahead of the latest IBD research? Like, share, and subscribe to our channel for weekly updates. We cover breakthroughs across multiple therapy areas, so visit www.lqventures.com and reach out to lucidquest@info@lqventures.com for healthcare consulting services. Thanks for watching, and we'll see you in the next video.